Urinalysis. A urinalysis is a group of physical, chemical, and microscopic tests. The test detects and/or measures several substances in the urine, such as byproducts of normal and abnormal metabolism, cells, cellular fragments, and bacteria. Many disorders may be detected in their early stages by identifying substances that are not normally present in the urine and/or by measuring abnormal levels of certain substances. Some examples include glucose, protein, bilirubin, red blood cells, white blood cells, crystals, and bacteria. They may be present because there is an elevated level of the substance in the blood, and the body responds by trying to eliminate the excess in the urine. Kidney disease is present. And lastly there is a urinary tract infection present, as in the case of bacteria and white blood cells. A complete urinalysis consists of three distinct testing phases. First is visual examination, which evaluates the urine's color and clarity. Second is chemical examination, which tests chemically for about 9 substances that provide valuable information about health and disease and determines the concentration of the urine. And lastly is for the microscopic examination, which identifies and counts the types of cells, casts, crystals, and other components such as bacteria and mucus that can be present in urine. So for the physical and chemical tests, there would be routine urinalysis and urinary calculi screening. And for the tubular function test, there will be tubular reabsorption of phosphate. So first is routine urinalysis. Routine urinalysis, one of the most widely ordered laboratory procedures, is used for basic screening purposes. It is a group of tests that evaluate the kidney's ability to selectively excrete and reabsorb substances while maintaining a proper water balance. The results can provide valuable information regarding the overall health of the patient and the patient's response to disease and treatment. So for the visual exam, a lab technician examines the urine's appearance. Urine is typically clear. Cloudiness or an unusual odor can indicate a problem, such as infection. Protein in urine can make it appear foamy. Blood in the urine can make it look red or brown. Urine color can be influenced by what you've just eaten or by certain drugs you're taking. And second is the dipstick test. A dipstick, or a thin plastic stick with strips of chemicals on it, is placed in the urine. It has a number of pads to indicate various biochemical markers. The chemical strips change color if certain substances are present or if their levels are above typical levels. Urine pH is an indication of the kidney's ability to help maintain balanced hydrogen ion concentration in the blood. Specific gravity is a reflection of the concentration ability of the kidneys. Urine protein is the most common indicator of renal disease, although there are conditions that can cause benign proteinuria. Glucose is used as an indicator of diabetes. The presence of ketones indicates impaired carbohydrate metabolism. Hemoglobin indicates the presence of blood, which is associated with renal disease. Bilirubin is used in the detection of liver disorders. Urobilinogen indicates hepatic or hematopoietic conditions. Nitrites and leukocytes are used to test for bacteriuria and other sources of urinary tract infection or UTIs. So lastly is for the microscopic exam, sometimes performed as part of a urinalysis. This test involves viewing drops of concentrated urine that's been spun in a machine under a microscope. If any of the following levels are above average, you might need more tests. White blood cells or leukocytes might be a sign of an infection. Red blood cells or erythrocytes might be a sign of kidney disease, a blood disorder, or another underlying medical condition, such as bladder cancer. Bacteria, yeast, or parasites can indicate an infection. Casts, tube-shaped proteins, can be a result of kidney disorders. And lastly is crystals that form from chemicals in urine might be a sign of kidney stones. So for the purpose of the examination, it determines the presence of a genitourinary infection or abnormality. It monitors the effects of physical or emotional stress. It monitors fluid imbalances or treatment for fluid imbalances. It monitors the response to drug therapy and evaluates undesired reactions to drugs that may impair renal function. It provides screening as part of a general physical examination, especially on admission to a healthcare facility or before surgery. A urinalysis is considered safe and non-invasive form of testing. The only risk it may pose is for those who require catheterization to obtain a urine sample. A Foley catheter, flexible tube inserted into the urethra to drain the bladder, is the most common type used in people with urinary retention, urinary incontinence, or other conditions that interfere with normal urination. The risk of urinary catheterization include infection, bleeding, pain, and bladder damage. So next are the interfering factors. Certain foods, such as onion, garlic, and asparagus, contain substances that may give urine an unusual odor. An ammonia-like odor may be produced by the presence of bacteria. Urine with a maple syrup-like odor may indicate a congenital metabolic defect or maple syrup urine disease. The various biochemical strips are subject to interference that may produce false positive or false negative results. Consult the laboratory for specific information regarding limitations of the method in use and a listing of interfering drugs. The Dipstick method for protein detection is mostly sensitive to the presence of albumin. Light chain or Benz-Jones proteins may not be detected by this method. Alkaline pH may produce false positive protein results. Large amounts of ketones or ascorbic acid may produce false negative or decreased color development on the glucose pad. Contamination of the collection container or specimen with chlorine, sodium hypochlorite, or peroxide may cause false positive glucose results. False positive ketone results may be produced in the presence of ascorbic acid, levodopa metabolites, valproic acid, phenazopyridine, phenylketones, or phthalanes. The hemoglobin pad may detect myoglobin, intact RBCs, and free hemoglobin. Contamination of the collection container or specimen with sodium hypochlorite or iodine may cause false positive hemoglobin results. Negative or decreased hemoglobin results may occur in the presence of formalin, elevated protein, nitrite, ascorbic acid, or high specific gravity. False negative nitrite results are common. Negative or decreased results may be seen in the presence of ascorbic acid and high specific gravity. Other causes of false negative values relate to the amount of time the urine was in the bladder before voiding or the presence of pathogenic organisms that do not reduce nitrates to nitrites. False positive leukocyte esterase reaction results from the specimens contaminated by vaginal secretions. The presence of high glucose, protein, or ascorbic acid concentrations may cause false negative results. Specimens with high specific gravity may also produce false negative results. Patients with neutropenia may also have false negative results because they do not produce enough WBCs to exceed the sensitivity of the biochemical reaction. Specimens that cannot be delivered to the laboratory or tested within 1 hour should be refrigerated or should have a preservative added that is recommended by the laboratory. Specimens collected more than 2 hours before submission may be rejected for analysis. Because changes in the urine specimen occur over time, prompt and proper specimen processing, storage, and analysis are important to achieve accurate results. Changes that may occur over time include production of a stronger odor and an increase in pH because bacteria in the urine break down urea down to ammonia. A decrease in clarity because as bacterial growth precedes or precipitates form. A decrease in bilirubin and urobilinogen because of oxidation to biliverdin and urobilin. A decrease in ketones because it is lost through volatilization. Decreased glucose because it is consumed by bacteria. An increase in bacteria because of growth over time. Disintegration of cast WBCs and RBCs, and an increase in nitrite because of overgrowth of bacteria. And now for the normal values. The colors should be clear, straw colored to dark yellow urine. The odor should be slightly aromatic. The specific gravity should be 1.005 to 1.035. And the pH should be 4.5 to 8. For the dipstick method, the values should be for the pH, it is 5 to 9. The protein should be less than 20 mg per deciliter. The glucose should be negative. Ketones should be negative. Hemoglobin also negative. Bilirubin negative. Urobilinogen is up to 1 mg per deciliter. And nitrite is negative. And for the leukocyte esterase is also negative. For the microscopic examination, the values should be for the red blood cells, it should be less than 5 high power field. For white blood cells, less than 5 HPF. For the renal cells, there should be none. For the transitional cells, it should be none. For squamous cells, rare and usually no clinical significance. For the cast, it is rare hyaline, otherwise non-seen. Ammonium urate, calcium carbonate, and amorphous phosphates. For bacteria, yeast, and parasites, there should also be none. For the deviations and its clinical significance, for the colors. For deep yellow, it may indicate the presence of riboflavin. For orange, it may indicate bilirubin, chrysofanic acid, pyridium, and santonin. For pink, it may indicate the presence of beet pigment, hemoglobin, myoglobin, porphyrin, and rhubarb. For red, it may indicate beet pigment, hemoglobin, myoglobin, porphyrin, and uroerythrin. For green, it may indicate the presence of oxidized bilirubin, chlorets, or breath mint. For blue, it may indicate the presence of Diagnex, Endican, and methylene blue. For brown, it may indicate the presence of bilirubin, hematin, methemoglobin, metronidazole, nitrofurantoin, metabolites of rhubarb, and senna. For black, it may indicate the presence of homogenesic acid and melanin. For if it is smoky, it may indicate the presence of red blood cells. And for the test, for protein, it may be increased in benign proteinuria owing to stress, physical exercise, exposure to cold, or standing, diabetic nephropathy, glomerulonephritis, nephrosis, and toxemia of pregnancy. For glucose, it may be increased in diabetes. For ketones, it may be increased in diabetes, fever, fasting, post-anesthesia period, high-protein diets, isopropanol intoxication, starvation, and vomiting. And for hemoglobin, it may be increased in diseases of the bladder, exercise, glomerulonephritis, hemolytic anemia or other causes of hemolysis, malignancy, menstruation, paroxysmal cold hemoglobinuria, paroxysmal nocturnal, hemoglobinuria, pyelonephritis, snake or spider bites, stroma, tuberculosis, urinary tract infections, and urolithiasis. For urobilinogen, it may be increased in cirrhosis, heart failure, hemolytic anemia, hepatitis, infectious mononucleosis, malaria, pernicious anemia, and may be decreased in antibiotic therapy because it suppresses normal intestinal flora and obstruction of the bile duct. For the bilirubin, it may be increased in cirrhosis, hepatic tumor, and hepatitis. For nitrites, it may be increased in presence of nitrite-forming bacteria. And for leukocyte esterase, it may be increased in bacterial infection, calculus formation, fungal or parasitic infection, glomerulonephritis, interstitial nephritis, and tumor. And now we proceed to the nursing considerations. First is before the procedure or examination. First is to obtain a history of the patient's complaints, including a list of known allergens. Next is to obtain a history of the patient's endocrine, genitourinary, immune, hematopoietic, hepatobiliary, and reproductive systems, as well as results of previously performed tests and procedures. Obtain a list of medications the patient is taking, including herbs, nutritional supplements, and nutraceuticals. The requesting healthcare provider and laboratory should be advised if the patient is regularly using these products so that their effects can be taken into consideration when reviewing results. Next is there are no food, fluid, or medication restrictions unless by medical direction. Next is to review the procedure with the patient. If a catheterized specimen is to be collected, explain this procedure to the patient and obtain a catheterization tray. And lastly is to inform the patient that the specimen collection takes approximately 5 to 10 minutes. So next is during the procedure or examination. The random specimen is collected in early morning. So for the clean catch specimen, you should instruct the male patient to thoroughly wash his hands, cleanse the meatus, void a small amount into the toilet, and void directly into the specimen container. For female patients, you should instruct them to thoroughly wash their hands, cleanse the labia from the front to back, while keeping the labia separated. Void a small amount into the toilet, and without interrupting the urine stream, void directly into the specimen container. Next is pediatric urine collector. Put on gloves, appropriately cleanse the genital area, and allow the area to dry. Remove the covering over the adhesive strips on the collector bag and apply over the genital area. Diaper the child, and when the specimen is obtained, place the entire collection bag in a sterile urine container. For patients with indwelling catheter, put on gloves, empty drainage tube of urine. It may be necessary to clamp off the catheter for 15 to 30 minutes before specimen collection. Cleanse specimen port with antiseptic swab, and then aspirate 5 ml of urine with a 21 to 25 gauge needle and syringe. Transfer urine to a sterile container. Next is for urinary catheterization. Place female patient in lithotomy position or male patient in supine position. Using sterile technique, open the straight urinary catheterization kit and perform urinary catheterization. Place the retained urine in a sterile specimen container. Next is for Suprapubic Aspiration. Place the patient in a supine position, cleanse the area with antiseptic, and drape with sterile drapes. Using sterile technique, insert needle and remove sterile sample. Place the return sample in a sterile specimen container. Place a dry, sterile dressing over the site, and do not collect urine from the pouch from the patient with a urinary diversion. Instead, perform catheterization through the stoma. Next, for general, label the specimen, indicate whether the specimen is clean cut or catheter, and promptly transport it to the laboratory. Indicate on the label the date and time of collection and any medications that may interfere with the test results. So lastly is after the procedure or examination. First is to instruct the patient to report symptoms such as pain related to tissue inflammation, pain or irritation during void, bladder spasms, or alterations in urinary elimination. Observe for signs of inflammation if the specimen is obtained by suprapubic aspiration. Next is to instruct the patient to begin antibiotic therapy as prescribed, and instruct the patient in the importance of completing the entire course of antibiotic therapy even if symptoms are no longer present. Instruct the patient with a UTI as appropriate on the proper technique for wiping the perineal area from front to back after a bowel movement. Next is UTIs are more common in women who use diaphragm or spermicide contraception. These patients can be educated as appropriate in the proper insertion and removal of the contraceptive device to avoid recurrent UTIs. And lastly is to evaluate test results in relation to the patient's symptoms and other tests performed. And lastly is for the precautions. Strenuous exercise before routine urinalysis may cause transient myoglobinuria or hematuria. Foods such as beets, berries, and rhubarb may cause the urine to change color.